Thank you, Dr. Logie and Dr. Kao. So I just wanted to touch a little bit on clinical trials. I think, it's really important to talk about, and it's something that we get asked a lot. So first of all, just touching on what is a clinical trial. So essentially there's four different phases of clinical trials that would involve patients. And as they progress, they get sort of, or get further along in testing, our confidence in their effectiveness goes up as well. So a phase one clinical trial would be following preclinical or in-lab data. Typically includes a broad range of patients. So it could be looking to see if a drug is safe and determines the appropriate dose. So you may see patients with all types of different cancers enrolled on the same clinical trial. In a phase two study, once we know a treatment is proven safe, we need to determine that it's effective in the disease site of interest. So this would typically be more focused around breast cancer patients using the dose that was determined in the phase one study. Phase three trials are typically what we use to inform our treatment decisions. So phase three studies are to confirm the effectiveness and determine if it's better than the current standard. And so this is typically where you would see a phase three randomized study that enrolls, large numbers of patients with this similar type of disease to confirm that it's better than what we're currently using. Phase four clinical trials are sort of after we see approval of a new treatment, and they're really important for determining the long-term safety and effectiveness and making sure that we know about side effects and that we're managing them appropriately. Next slide, please. So how do you know if a clinical trial is a good option for you? I think it's always important to ask, and I think oncologists are really receptive to this question. There are, of course, pros and cons, right? So the reason that it's in a clinical trial is because we don't know if it's better. So it does give you access to a newer therapy, but the reason that we're testing it is to confirm that it's better than what's currently available. It's also advantageous in the sense that you would have closer surveillance and follow-up. So a lot of times on clinical trials, you'll get more visits with your oncologist, there's more blood work, maybe even more frequent scans. And then of course, a really important part of clinical trials is it's how we get new agents. It's how we learn more about breast cancer. It's how we get better and better at treating it. And it's the reason why the outcomes with breast cancer are so much better than they used to be. The cons of a clinical trial, so you may get unexpected side effects or serious side effects that we're not aware of going into the clinical trial. And then for some people, the close surveillance and follow-up might be a con. Depending on how far you live from the cancer center, it does mean more frequent visits. And some patients don't like frequent scans and frequent blood tests because it sort of is anxiety provoking and just means more investigations. Next slide. So I think this is a really good example of a clinical trial that we actually had open at the Tom Baker Cancer Center. And so, the question is, how do I know if a clinical trial is right for me? It's always important to ask. And so typically we are all aware of the studies that we have open at the Tom Baker, and we're enthusiastic and we're really compelled to enroll patients on clinical trials that we think are going to benefit them as an individual. And so a really good example of this would be the Destiny Breast 03 study. And this was the study that for patients who have HER2 positive type of metastatic breast cancer were randomized to a new drug called T-DXd versus the standard of care, which is T-DM1. So T-DXd is also an antibody drug conjugate. So it's an antibody that binds to the HER2 receptor and is conjugated to a chemotherapy molecule. So it's similar to T-DM1, but it has some key differences in terms of the concentration of the chemotherapy molecule that gets released. Can you press forward, please? And what we saw in this study was that patients did dramatically better on this new drug. So the median follow-up time of 15 months, we saw a superior progression-free survival with T-DXd that wasn't reached versus 6.8 months with the standard of care. The Drug-related events, though, were something that's important to look at. So TDM1 is a really well-tolerated medication, whereas TDXD does have some more chemotherapy-like side effects. And so we did have to get used to managing the nausea. There's more hair loss, and there's a rare but important risk of inflammation of the lungs. So it was a really important practice-changing clinical trial in the sense that we learned that this new drug is really, really effective at treating this type of breast cancer. But we also have to be really careful when we're using it because there's some really serious side effects we have to look out for. So I think it's always something that we as oncologists are happy to discuss. I'm happy when patients bring clinical trials that they've heard about at other places in the country to me to discuss, because some of them are really promising. Like, this is a great example of a clinical trial that I would be really excited to put a patient on to. Whereas some, earlier phase 1 clinical trials are probably less likely to benefit an individual patient. And so I think we have to be cautious with how hard we pursue things like that. But certainly clinical trials are a really great option of treatment.